my name is Liz Maida. This is my case study presentation 1. So my client is a 5-year-old male and he has an ASD diagnosis. The main behavior concern that we're looking at is elopement. This is defined as any instance of the learner leaving, moving 5 or more feet from the designated area without permission. An example could be the client gets up from the table and he runs to the other side of the room in the clinic before the designated task was complete. A non-example could be the client is playing with other peers and he runs to the other side of the room while he's laughing. Next, we're going to look at the positive and negative reinforcement contingencies on this behavior. So for positive reinforcement contingencies that we observed were access to tangible and also maintained by attention from adults. So it was observed that during times of elopement, the client would leave the area and he would go try to access a variety of reinforcers such as the swing and the trampoline. It was also observed that during times of transition, the client would elope and look back at the therapist seeking attention. We would see him smiling, sometimes laughing, when the therapist would follow the client and attempt to redirect. This often happened at times when he had to transition to the bathroom. He would try to elope and laugh when we would try to redirect him. The negative reinforcement contingencies that we observed was maintained by escape from adversive stimuli. So when presented with a demand or a non-preferred task, the client would elope from the therapy area or the therapist to delay engaging the non-preferred task. As far as assessments, a functional assessment interview was conducted with the mother to begin to understand potential contingencies. Also, many observations were made in the clinic during one-to-one therapy. This helped us better understand contingencies of the behavior. And last, a reinforcer assessment was done from different therapists across about 2 weeks. Interventions that we focused on were FCT, that's functional communication training. So we taught the replacement behavior of stating a variety of words such as all done, go, or break. When the client attempted to leave the area, the therapist would just gently block and prompt the client to say one of the replacement statements. As soon as the client said that, they were able to leave the area, and the therapist would tell them, "Nice job," give them some verbal praise. So we also ended up utilizing a timer to increase the tolerance of non-preferred activities, and a choice board was created. We used a variety of reinforcers that we discovered during the reinforcer assessment, and this was made available so the client could appropriately request items and or activities. So for motivating operations, the functional communication intervention allowed the client to escape non-preferred tasks appropriately just by asking for a break or stating all done. The client was also able to appropriately demand for desired items, activities, including tangible and social reinforcers. In the beginning, he really liked to ask for the swing, the trampoline, hugs, squeezes, and pushes on the swing. As far as generalization goes, this intervention is being conducted across multiple therapists in a one-to-one setting, as well as being incorporated in other disciplinaries. He goes to speech once a week, and speech is actually in the same building. We talk to each other. It's just like an open communication, so the generalization piece is really there across all the disciplinaries. Also, it's promoted in the home setting as well, and prompts are faded as the client reaches mastery criteria, so that kind of covers the maintenance aspect. As far as outcomes, his elopement behavior has been reduced as that he can now successfully mand utilizing the choice board, and also his spontaneous mands have increased. During the initial weeks of treatment, we did see some obstacles, and that included additional problem behaviors increase such as crying, as well as the client struggled to sit for any duration of time during non-preferred activities. This included lunch and circle time. So that is when we decided to incorporate the timer. This was to provide that visual support. Currently he has mastered 45 seconds. We're going to keep gradually increasing that time until we can reach the long-term goal of 5 minutes. And that concludes this slideshow. So thank you for listening.